So the big story this morning, a COVID-19 vaccine that Pfizer says is 90% effective.
The encouraging news comes as the country shatters records with more than 10 million confirmed cases. If the vaccine gets approval, here's how it would work. Pfizer says it would be given in 2 doses. The second dose 3 weeks after the first dose. And what will it cost? Around $20 for each of the 2 shots. But because of a deal between Pfizer and the U.S. government, that cost would be covered and free for everyone. And we do want to remind you this vaccine has not been approved yet. It has to clear several hurdles before your family will have access to it. Emily Longnecker breaks down the process.
Indiana could see its first shipment of a COVID-19 vaccine by mid-December, but state health officials say that's not set in stone.
We don't know for certain when we'll receive our first vaccine or when we'll have enough vaccine to immunize every Hoosier who wants the COVID vaccine.
First things first, Pfizer is still testing and still needs federal approval. They could ask for emergency authorization from the Food and Drug Administration by the end of the month. From there, doses would get shipped out across the country. And once it gets to Indiana, state officials say it will undergo scrutiny before it's handed out.
That we have assembled a team to review all research related to the vaccine so that we can ensure that it is safe for Hoosiers.
Then phase 1 begins. The first people to get the vaccine will be healthcare workers and those most at risk, people 65 years and older or with other health problems. Then in phase 2, people at higher risk because of their working or living conditions. Think correctional facilities, group homes, and shelters. This will also include essential workers like law enforcement, teachers, food service, public transportation, retail, and warehouse employees. Not until phase 2 is complete would the general public have access, and that might not happen until 6 months after the initial vaccine is available.
The best protection until then, say state health officials, is wearing that mask, social distancing, and good hand washing.
And Indy-based Eli Lilly also has some big news when it comes to a COVID-19 treatment. One of its antibody treatments just became the first to get FDA approval. The drug is for those older than 12 with mild to moderate symptoms that are at high risk of getting much worse and needing hospitalization. This emergency use authorization allows doctors to use the therapy far more often. Until now, it was limited to clinical trials.
And as we wait for more news about the vaccine, Indiana is continuing to see a high number of new cases every day. We reported another 4,200 cases yesterday. A new record was set over the weekend with more than 5,000 cases reported for Friday. Another alarming trend is the sharp increase in the state's positivity rate. It's climbed to 9.6%, well above the goal of staying under 5%.